let's get on with the strategy. So I don't think I need to say this, but I want to say it because I want you to hear it. And that is that I believe this trust is a high-performing and a vital organisation, a vital trust for the delivery of care both in Wirral and in East Cheshire, and for the contracts that we hold in Liverpool as well. We are a great trust. Don't let anybody tell you any different. I've worked all over the country, Scotland and Wales included. We are a very, very good trust. We are intensely ambitious for the health and well-being of people on Wirral and indeed Cheshire, demonstrated today by what you can see in front of you, and by the commitment of our staff that have helped us build this strategy, which I'm here today to launch. I want to share with you. I'm very proud of. It's not a new strategy. I think it's fair to say it's a refresh of our strategy, but it's about modernising it in terms of making sure that we're fit for the future. Before I do, though, what I want to do is share with you some reflections after hearing the story at board from a couple of our service users. Great, thank you. This is Jean and George, and we hear a lot of stories at board, some great, some good, some not so. This is one of those not so moments that sort of just leaves you cold for a moment, and you have to think very seriously, are we getting it right? Joan has motor neurone disease, a progressive bulbar palsy. It's quite severe and it's quite debilitating. She receives care from a number of our services, including nursing, physio, speech and language therapy, nutrition and dietetics. It's fair to say that some of that care provided by us lacked the necessary continuity, coordination and most importantly, the person-focused approach. For me, this story epitomised why we had to refresh this strategy and change what we do, both as an organisation but also as an organisation within a system. And I'll come on to a little bit more of that in a moment. Sorry if you can hear the papers. I did a refresh of this last night. The old-fashioned way. A pen and paper. What I can tell you, as a result of hearing this story at board, Joan and George are now receiving excellent care. And George has also reported that how refreshing it is to have a team supporting Joan who make her feel very special. And they are genuinely interested in her and her particular requirements and situation. Thank you. Most people we know are living longer with multiple long-term conditions. This requires new thinking by us and by service providers in the system that actively support people to stay well and independent. In addition to what we see here, this is a staggering piece of data. We know nationally that in the next 20 years, the over 85 age group will double. Just take a moment to think about what that means for health and social care services. So we are working within a time of required rapid change, with a much greater emphasis on how the organisation works together to meet the challenges of improving health and care services affordably. Wirral is facing the challenge of reconfiguring services to meet projected increases in demand, and East Cheshire is facing similar challenges. You'll be familiar with this slide, a lot of you, I know you will. But this represents how we can respond to the challenges. We are working with partners across Wirral and Cheshire to develop place-based care, to provide proactive, better coordinated care with expanded and integrated primary and community services, focusing on promoting well-being throughout life. So, we hear a lot about place-based care, integrated care systems, ACOs. We could go on forever, couldn't we? What do we mean by that? What we mean is providing care and support, starting at the point of keeping people well, and progressively working towards when they need us, when they're ill, we'll respond, and we'll respond in an accessible and prompt manner. Realising the potential of place-based care requires effective intelligence and integration of our services across geography. I believe this organisation has a critical role to play, and in many situations has a leading role to play for Wirral and indeed East Cheshire. Uniquely, I believe we have the expertise in both community health and social care, with ambition, scale and ability to act as a system integrator, working with organisations and groups in primary care, mental health, secondary care, the independent, voluntary, community and faith sectors, providing the necessary underarching stability and platform from which to grow. What I mean by that is this organisation is a fabulous foundation on which to platform other services and support other services to be successful. This is the model. It's probably familiar to all, and that is 5194. We've got 51 GP practices, 9 distinct neighbourhoods with very, very different needs and requirements, 4 hubs are communities and 1 Wirral. We also have a significant place in East Cheshire, which we assert very robustly with the support of the staff in that area. So, place-based care then. It is better for staff. I'm not going to go through lots and lots of examples because I'm sure that you can think about them. But working together, using the best use of our people resource, their skills, their talents, and their dedication and commitment. This helps us identify and remove duplication and waste, but it also helps us do 2 other things. It makes the working day better for you. If you feel vital, you feel involved, you feel like you know you've given a good day's work, rather than going around mopping up stuff and duplicating other people's efforts. It becomes very frustrating. I know, I've been one of you, I've been there. The second and other issue is something that we're doing for Wirral, but also many of you will know that I'm the lead Chief Executive for Cheshire and Merseyside, to build a workforce strategy that works across geography. It's no longer good enough to build an organisational work strategy in splendid isolation. The resources are not that abundant. We need to hone those skills, bring them together and ensure that the pathway services we build with other organisations have the right workforce with the right skills fit for the future. Furthermore, it's better for local people. Staff can coordinate and share patient and clients' intelligence and information in a safe way together, removing duplication for the patient and client as well. It's very frustrating, we all know that, when they're asked the same question 6, 7, 8 times. One record, 1 point of access, that is what we are aiming for as a geography, not just an organisation. Furthermore, it promotes continuity of care and it helps teams work in the community and indeed other areas smarter and not harder. And I think the other thing for me is, once it's in place and we have that integrated care offer, it creates a more autonomous place in which the practitioner and indeed other services can work, making decisions at appropriate level for themselves and not having to escalate everything up time and time again for permission. So, we still aspire to be the outstanding provider of high quality integrated care to the communities we serve. Why wouldn't we? That's what our raison d'etre is. And these values are still at the heart of everything that we do. Our strategic objectives are 3. We've renamed this one, populations, to embrace, if you like, place-based care and population health. This used to be called patients and communities. I'm not going to go through these word for word because I don't want you. This day is about you having a good time and really getting involved in networking and working together. So I'm going to say for these 3 slides, we'll achieve these goals through real engagement with local people. I'll come on to that a little bit later. Secondly, we'll achieve these goals through working with you. So what I mean by that, this is where the eyesight starts failing. What I mean by that is real staff engagement. We haven't cracked that yet. We're trying everything we can. We're still not there. If you've got a great idea today or you think we're not doing something that would be so easy for us to do, tell us, please, because we genuinely mean we want to engage better with our workforce. We will also do it by working with you on helping you stay well in the workplace and at home. You are, after all, many of you, part of the populations we serve. Further, we will invest in your development, both as individuals and as teams, and we had a good meeting with the senior leadership team and the executive leadership team yesterday in terms of developing a leadership forum, and that is something we're looking at with great interest, that we will extend into the organisation, not just for that group. So then, lastly, our performance. I can't underestimate, and you probably get really tired of hearing this, but it's really important that we sustain the amazing performance that we've made improvements to in the last couple of years. You should be very, very proud of what we've done in the last couple of years, you really should. But it's absolutely clear that only by continuing to sustain and improve our performance will we remain a vital and vibrant service and an organisation with a special and unique skill set that offers people care and support outside of hospital services. And I don't come off that platform very often because I think we are different, very different to the professionals who are wonderful people, but they work in a hospital. We have a unique offer in the field. In the strategy we have 3 core areas of development and innovation. The first is around integrating neighbourhood teams around the neighbourhoods we talked about earlier, integrating pathways and services, yes with other providers and yes across geography, and that's where the workforce strategy will come into its own. And finally, by promoting health and well-being. I personally believe, and this is probably a P45 moment for me, I personally believe that this is something that has taken a bit of a back seat in the last few years, and we've really got to wake up and smell the coffee, not us, but the whole of the system. If we don't keep investing and put more investments into health and well-being, we've got a tsunami of illness, literally, just over here. So by focusing our efforts in these areas, we can start to change the way our services are delivered in Wirral and Cheshire, improving the health and care outcomes for our local populations. One piece of great news, I was at the publication, if you like, of the annual report on the Wirral 2020 plan. If you don't know what that is, go onto the local authority website and have a look at it, but many of you will. And for the first time since I certainly came into post, I'm not actually saying anything certainly it's you, but for the first time we've seen a small reversal in life expectancy for gentlemen on Wirral. It was awful. It started to turn around, it started to improve. That's through our efforts. Let's keep going because we need females now to do the same things. But we need to reduce that gap. It's a huge gap and we can do something about it. Strategic Programme 1 then, more integrated teams at neighbourhood level, social and healthcare, including a practice level where it's appropriate, and joining up that care across primary and social care and across disciplines so that people don't actually know, I'm not sure that they actually care that much, they just want to get the care that they need when they need it. And they will support people proactively. The big push here, and back to affordability, is if we get this right, we will see a reduction in the system pressure we see every winter, but starting to creep into spring and summer, on the reactive way the health and social care services have to work at the moment, repeatedly on episodic management of care. And we've got to move away from that. We've got to get ahead of that curve. Programme 2, integrated pathways and services. Realising the potential of an integrated neighbourhood team depends on proactively identifying and assessing people's needs, informed by effective intelligence gathering and build and risk stratification. Grand words. What it actually means is if we know more about the needs of the neighbourhoods, we can target our resources better. And Programme 3, supporting physical and mental wellness considering social as well as clinical needs will help people maintain quality of life and independence longer. And when they are ill, and when they do need support, more efficient and effective use of health and social care. Our staff and those of our partners have untapped potential, I believe, to positively influence people's lifestyles and help them connect with supportive groups and services. And they don't necessarily have to be across the statutory sector. There are so many wonderful independent, voluntary, charitable and faith organisations across North and Cheshire. And I do not believe we give them the credit and the kudos that they deserve. We've got to get better with that. So in order to do this, new ways of working alongside innovation, we need some key enablers. These are some of them. Information management and technology. This is something we've really got to step up to the digital plate on. For those guys who are here from the IT department, you know what is out there. Many of you will know what's out there. If you know something that we ought to know and we ought to be looking at, you need to be telling us. Don't assume we will know. But we've got to get better at gathering digital intelligence to target our resources better. Business intelligence I've mentioned. Also quality improvement skills, training and development for staff. This is not something that comes natural, we know that. We know we've got to invest in your training and development, and we will do that. Integrating appropriate services across geography and whole system planning, whole system workforce redesign. Also, we need the governance structure, the infrastructure to support that. We have that now on Healthy Wirral. Healthy Wirral Partnership has a governance structure in place. I'm the Chief Executive of the Provide and Chief Execs Forum, which is made up of the local authority, CWP, WUF, two federations and our stars. We are probably at a point now where we are signing an agreement of how we will work together proactively on behalf of the people of Wirral. We now move into how do we expand and evolve that group so we're making clinically led decisions. So, we can make a difference. I believe we can make a difference by listening to our population and finding new ways of working with them contractually. That's not a signed contract, that's an agreement between parties on what they want us to do. And that's not always the same as what we want to do for and to them. Listening and engaging is real, it's tangible. We need to be able to evidence it. Working better and smarter with our colleagues in primary care. I don't mean just GPs, I mean the whole gambit. Reconfiguring services around neighbourhoods, fully integrating those teams across health and social care. Targeting the use of our resources in a way that meets the needs of that neighbourhood. And continuing to build our out-of-hospital offer with our partners. And if we get this right, we'll also support our hospital, because we want our hospital. We need our hospital, and we need it to be efficient, and we need it to be there when, and reserved for when we absolutely do need it. So by working better together with our partners, we can support our hospital too. So, before I finish, and this is my penultimate slide, I just want to play a YouTube clip to you. Many of you will have seen it, and it talks about place-based care. And when you see it, the first thing you'll say to yourself, which is what I did, is, yeah, I know that. Yeah, that makes sense. Tell me something I don't know. What I really want you to ask yourself is, have you cracked it yet? Thank you.
Over the next 20 years, the number of over 85s in the UK will more than double, meaning many more of us with multiple long-term health conditions. Our current health and social care system won't cope. Fundamentally, it's the same system as when the NHS was set up, designed to treat episodes of illness one at a time. Already, we're failing to give vulnerable people the care they need, and we're set to run out of money fast. Meet Sam. He's 87 and suffers from emphysema, a disease that makes it hard to breathe, and also has type 2 diabetes and arthritis. Sam was coping pretty well until his wife passed away, but is now lonely and increasingly depressed. Sam frequently visits his GP, but finds it difficult to discuss all his needs in a brief consultation. If Sam can't get hold of his GP in a crisis, he calls for an ambulance. Each time, Sam spends time in A&E and is often transferred to a ward as well. He sees lots of different healthcare professionals and has to explain his conditions repeatedly. Frustrating. And Sam often has to wait to be assessed by social services before he can go home. The result? A lot of unnecessary time in hospital. And when he gets home, a lack of coordination between his GP and social care often means he doesn't get the support he needs. Eventually, after several hospital visits in just 6 months, it's decided to admit Sam to a care home. But what if Sam's health and social care services were more joined up? Let's imagine one of Sam's carers is given overall responsibility for coordinating his care. For example, Kathy, a district nurse. Kathy meets with Sam, his GP and his social worker. Sam explains that he wants to manage his conditions at home, and together they design a care plan which they can all access online anytime. Sam now gets more visits from Kathy at home, which helps him manage his emphysema and diabetes. On the occasions when he does have a crisis, Sam calls Kathy rather than an ambulance, so goes to hospital less frequently, and even when he is admitted, he's discharged after a quick review of his care plan rather than having to be reassessed. In this scenario, Sam's health and social care is funded from a joint budget, so the team can make smart decisions about how it's spent and call on the help of other social services. For example, as his condition deteriorates, the team decide to fit a seat in Sam's shower, providing with an oxygen cylinder to ease his breathing, as well as a medication dispenser with a voice prompt to remind him to take his pills. Kathy talks to Sam about his loneliness, and he agrees to weekly trips to the shops with a volunteer from a local befriending charity. So now, Sam doesn't have to be admitted to a care home, instead getting the help he needs in his home. He feels happier, is healthier, and better use has been made of resources within the system. Let's recap on what transformed Sam's care. Put simply, local leaders in the NHS, social services and the voluntary sector created a shared vision of what good integrated care looked like, centred around the needs of people like Sam and their carers. They pooled resources across health and social care, built multi-professional teams and created systems to allow Sam's information to be easily shared. Sound idealistic? Well, this is actually already happening in a few places. Now it's time to make sure it happens everywhere. Let's reimagine how we provide care. Get inspired at kingsfund.org.uk/joinedupcare.
Thanks, Selena. Thank you. I'm not going to comment on it. I'm just going to leave it with you. Have a think about it. Talk today about it. That basically is the launch of our strategy. Can I find
When it comes to healthcare, there are many ways to get care. There are organizations that...
He had a better voice. Okay. Use today to talk to each other, network, but don't lose the message in there, because I don't think we've cracked it yet. And I think there's a lot more we can do. And the people in this room and the people who work with you and for you are the right people to make that happen. And lead an awful lot of it. I do believe that. So that's it. Strategy launched. Thank you to everybody. Could you thank people who work with you and for you as well, because I know many people were engaged to put this strategy together. But before I finish, I've got one more thing to say. And that is, we are having a launch of a refreshed organisational strategy today, which we share with our partner organisations in good faith and with local people. So after you've all heard this today, I think you will agree that there are some big messages for us. Engaging with local people better, engaging with staff better, engaging with each other better. In support of this, I want to share with you today that we are going to start, as of today, an engagement process with local communities and stakeholders. To be clear, it's not consultation, it's an engagement process to change the name of this organisation that better reflects what we believe describes who we are and what we do. I don't know whether you can do this on film, so you might need to edit the next bit. But it's a bit of a Ron Seal moment for us, yeah? We've got to say what we do on the tin, we really have. Therefore, helping local people and other organisations have an increased understanding of what our services offer. So if you can put the slide up. We are proposing that we change our name to Wirral Health and Care NHS Foundation Trust. It's not wonderful, it's not sensational. We have to stick with the lozenge, we have to stick with the geography, we're told by NHS England to do that. But actually the word community confuses, believe it or not. And we tested it, and it does. So we believe we are a health and care organisation. And that, Ali, am I right, that engagement starts today. So that's really all I have to say. Don't lose your energy. Remember how well you sang to Fiona. Fiona will make sure that you do remember that. Keep the energy going in the room. I can't stay with you all day because I've got to go over to the Confederation and talk to a number of the community services chief executives about the national build of community services and primary care. But I do hope you have a wonderful, wonderful day, and I'm looking forward to the feedback when I get back. Okay, thank you very much.